Now, we're going to play some excerpts from our KATV roundtable on the subject. Dr. Joycelyn Elders, former U.S. Surgeon General, and Dr. Greg Bledsoe, current Arkansas Surgeon General, were two of our guests with KATV's Chris May.
In the larger public health community, when it comes to the debate over medical marijuana, what is really at the heart of the debate? Is it safety? Is it efficacy? What is it, Dr. Elders?
Well, I'm not sure I would know absolutely. I think that certainly we know that there are certain patients that have definite benefits. As far as safety, we use lots of other drugs that are far more toxic for the patient, more poisonous. One thing we can say about marijuana, it's never killed anybody that we can document. We look at alcohol, and we look even at tobacco. These are drugs to me that are far more toxic and cause far more deaths. So I don't think we can throw it up as a safety issue.
Dr. Bledsoe?
Well, I think there's a couple of camps when you look at people who are involved in public health. There's two extremes. There's one extreme that says that marijuana has no medicinal value under any circumstances. That's not my position. Obviously, that's not Dr. Elder's position, and that's not the position of the majority of people who are in healthcare. The other extreme is that marijuana is a miracle drug, that it does everything, it cures everything. That's also an extreme position and not something that the majority of healthcare providers are in favor of. In the middle is where most people are. And I've found that when you talk to healthcare professionals and you say medical marijuana in general, a lot of people are in favor of it. The details really matter, and that's why I think that this debate and this forum tonight is so important, because the details, when you talk about the laws, that's where healthcare professionals start to step away from that medical marijuana definition and say, I'm not sure I'm in favor of that. So if you go into a crowd of physicians and you say, hey, are you in favor of medical marijuana? A lot will say yes. And then you say, are you in favor of 15-year-olds with ADHD getting marijuana to vape or to ingest? Not so much. So the specifics really matter, and that's where you start having the divergence.
So you believe that marijuana can ease severe symptoms. If the FDA,
sure.
If the FDA were on board, would you be on board with this as
Absolutely. As a matter of fact, there's a pharmaceutical company in Britain, GW Pharmaceuticals, that has produced two other marijuana-based pharmaceuticals, Sativex and Epidiolex, and both of these are going to be coming probably through the FDA approval process and approved in the next year or so. And that's how it should be done. We should be squeezing all the medicinal value out of this plant. We should be purifying these compounds, isolating them, and then dosing them appropriately for patients. I don't think any reputable physician or clinician is against that. We want to help our patients. My argument is that when you hand out the plant, that you can't control the dosing, you don't know exactly if it's efficacious or not, if it actually works, and you worry about impurities and whether or not you're giving it for the right diagnosis. So there's so many things that go into that. But using those compounds, isolating them, purifying them, and then giving it to patients, that's the way it should be done. I'm all in favor of that.
Are you worried about that, about the inability to control the dosage, no prescriptions?
I think, we've not done the research on marijuana that we should have done. It's been, we've had it for years. We've known about it, and because of marijuana, and nobody wanted to do the research. They couldn't get in the purified form, or couldn't get it excuse me, in the form to do the kind of research they wanted to do. So I think now the NIH and the health system is trying to do the kind of research now that we should have done 100 years ago.
Right. So in the absence of that, we find ourselves where we are now. Governor Hutchinson opposes both of the measures that are on the ballot. He said the measures don't lead to good medicine, and he says, quote, we don't vote on cancer cures in our society, and we should not set a new pattern of determining what is good medicine at the ballot box. Dr. Elders, does putting medicine up for a vote give you pause at all?
I really think the best doctor for any patient is the doctor that's looking at that patient and the doctor that makes the decision. But when we're talking about medical marijuana, you're talking about a doctor who has made the decision that this is the best medicine that I have available for my patient. And I think that when we're out there trying to decide what this doctor should order, I think that that's trying to legislate how we practice medicine. Sure, We all wish that we'd done the research. We all wish that we had the better drugs. You know, none of us are proud of some of the drugs that we have for many of the symptoms we have. But I think that what we're doing, you know, making it available for the patients that really need it and whose doctors want to order it, I think that's the best we can do today.
Is this standing between a doctor and their patient?
Well, I don't think so. And I look at this again as the general theoretical debate versus the specifics. I mean, when you look at who has actually endorsed Issue 6 and Issue 7, there aren't very many healthcare professionals. I read out earlier a long list of people who've opposed it. Dr. Elders has not endorsed either of those. To my knowledge, other than Melissa, no candidate for any office in Arkansas has endorsed Issue 6 or Issue 7. So when you look at the specifics, that's what the voters need to look at, the specifics of all that. And I think, you know, when you talk about doctors and their relationship with patients, that's a very sacred bond that you have. But still, the treatments that we're giving our patients should be based on the medical literature. And when you look at the medical literature, it does say that the compounds in certain cases do help. But all these broad diagnoses that are especially in Melissa's issue, there's no medical literature to support those.
And it was an interesting conversation, and one that you as a voter should get familiar with if you plan to vote on the subject this November. You can catch a full replay of that whole 1-hour conversation at katv.com.